I am welcoming everybody right now to our COVID-19 webinar with Dr. Samuel Chun. Sam is from Washington University. My name is Chris Marty, and I'm the VP of Data Analytics and Executive Education at the Metal Service Center Institute. Before we get started, I'd like to go over just a couple of housekeeping items. You are all on mute for this webinar. Well, there's some flutter. And you'll stay on mute for the duration of the webinar, and your video will be automatically turned off. This is a webinar in the Zoom webinar format. So you will have, however, the opportunity to ask questions using the Zoom Q&A interface with Zoom. So please do so whenever you have the inclination, and we'll watch the queue and we'll answer any questions you might have during the webinar. So please do so because we're interested in what you'd like to know. Now, I'd like to introduce Dr. Samuel Chun. Many of you know Sam from participating in MSCI's Strategic Metals Management Program. Sam has played a crucial role in that program since its inception, so we've known Sam for over 15 years at MSCI. Sam is an assistant dean and the director of executive education and a professor of management practice at the Olin Business School at Washington University in St. Louis. Sam was an assistant professor of business administration at the Harvard Business School. Sam's prior employment includes service as a regional director of American Express, as the president of a Pacific Rim-based supply chain management software company, and Sam was also an economist and a consultant at the United States Department of Labor. Sam teaches the following at Washington University: strategy, critical thinking, innovation and growth, business-to-business marketing, pricing, and management development. I would dare say Sam teaches all of that in our SMM program as well. Sam has a background in statistics and data science, which he also teaches to MSCI executives in our new Data Science for Metal Executives program. So we'll get started. We're going to cover three major topics today, but our questions and your questions may lead us on some tangents, and that's perfectly okay. Number one, we're going to do a non-professional's take on what we're calling the biostatistics of the pandemic and the epidemiology. We're going to talk about what it might take to open the US economy. And finally, we're going to talk about lessons learned. And under that header, we're going to especially touch on things like supply chain and the changes going on there and what might happen in the future. So, Sam, welcome.
Hi, Chris. How are you?
I'm good. How are you?
Hey, one thing, there are questions already flowing in, and we'll get to those. You'll get to those when time
I
comes.
certainly will. But let me ask you a qualifying question first.
Sure.
What does it mean when we say a non-professional's take?
That basically means I'm not that kind of doctor. I have training in modeling and statistics, and I've actually worked with a few textbook examples of disease modeling, but only in like courses. I've never really done any of this stuff. And I think we live in a time right now where everyone is sort of being asked to be an amateur epidemiologist, biostatistician, and it's hard. I mean, so I guess what I'm saying is the more I read, the less I know, and the less I think I know. So everything I say is with a caveat. That's the point.
Okay, so let me ask a couple of questions in our first topic, because I'm interested to get your take on a couple of things that have happened in the last couple of weeks. There was a time when a lot of states started to issue shelter-in-place orders.
Yeah.
Governors, I think that there are well over 30, almost 40 states now
Yes,
who
I think
have a
that's right.
shelter-in-place order in place. But a couple of weeks ago, all of a sudden, when things looked really dire in the pandemic models, things got not rosy, but started to look a lot better. What
Sure.
happened there? Why the quick?
Yeah, things looked a lot better if you were in America, not necessarily if you're in Italy. That's the first thing. I mean, Italy and Spain were just absolutely whacked. But those models are exactly what they're models. You know, they're kind of two varieties. One's sort of rooted in, if you care, differential equations, and another is rooted in statistical estimation, and they're based in assumptions. And I think a lot of the point of these models is that they actually check best case, worst case, and midpoint scenarios. And it's understanding that these things can change. And sometimes when you forecast a certain level at a worst case scenario, your hoping behavior kicks in so that it's not as bad as that. I mean, that's, so I think those forecasts were really based on worst case. Also, those forecasts were based on assumptions. And I think it's safe to say that we don't really know a whole lot even now. And as new data flows in, like, you know, death rates and infection rates and some people who don't even exhibit symptoms, as those inputs go in, these models adjust. Having said that, is it prudent to forecast worst case scenario when lives are involved? I mean, that's a decision that we all have to kind of make on our own. I mean, some people say yes and some people say no.
Sam, how familiar are you with some of the models being used? Because if it's okay, I'd like to ask you to describe some of the inputs, because you mentioned the assumptions. I'm assuming that's what you meant. So what are the kinds of...
Well, you know, the most basic one is it's just indifferent. You're looking at rates of changes in things like susceptible populations, infected populations, removed populations, and exposed populations. And, you know, it's all d something dt, you know, over time. It's like a derivative if you remember your calculus. And some of the inputs in there are how many people you think are going to be exposed. And you start with things like an assumption of how many people does one exposed person infect when they're contagious. And then you start to bridge into, you know, how, if that ratio, if people start to recover at a certain rate versus people get infected at a certain rate, that kind of defines this kind of basic reproduction level. And you start off by making guesses because you don't really know. But then when the percentages start to come in, you start to put in real numbers. Like, so if you're reading the news right now, the French aircraft carrier Charles de Gaulle, so these boats are actually incredible experiments because it's all contained. And I think it turned out that on this ship, aircraft carrier, the French aircraft carrier, 60% of the people ended up being positives. And of the positives, 50% actually weren't exhibiting symptoms. And of the ones who are exhibiting symptoms, then it bifurcates into, you know, a bunch who get like, you know, kind of sick, and then a bunch who get like really sick, and a bunch who just absolutely get whacked. So as those new data come in, you start plugging in what you actually know instead of guessing best case, worst case, midpoint, and you start getting refinements. So, you know, on the one hand, I think you could call out that we've overreacted. I mean, I say these words carefully because these are loaded words. On the other hand, because we overreacted, we might be in a position where we're actually better off than we could have been. I mean, do you agree with that or not? I don't know. That's up to you. But I think that's kind of what I see happening, especially in St. Louis. In our locale, this is exactly playing out.
Interesting. You just mentioned the variation in how ill certain people get, because in the public perception, it seems to bounce between something like this is just a bad flu, and it's actually a modern day plague. So how does the epidemiology compare to the bad flu versus?
Okay, so this really has to be caveated. I am not a disease. I know some infectious disease people that I've been speaking with, and some pulmonologists. My brother-in-law is a pulmonologist, so he sees COVID patients pretty much many times a day, every day. It's not a flu. I mean, it's a different disease. So that's simple. It's not the plague. I mean, the bubonic plague has a kill ratio that's far higher than this, and it's not even close. But it is times worse than the flu. Now, we don't really know right now because there's this bunch of people who walk around who don't exhibit symptoms. So if you don't exhibit symptoms, you're fine. So the death rate, I would say that it's probably the case that the current fatality rate is a ceiling, in terms of how bad it's actually going to get. Because if half of the people are out there not actually exhibiting symptoms, then the fatality rate absolutely has to fall because denominator gets bigger. But there are other things. So Guayaquil in Ecuador. Last time I looked on Wikipedia, I think they were reporting maybe 9,500 cases. And on those like 9,500 cases, they're reporting about 500 deaths. So 500 deaths over 9,000 cases. I mean, but then you read these stories about how their bodies and corpses piling up on the streets. And there is a statistician in Ecuador who's actually doing a baseline estimation. So the first 6 weeks from March 1st to mid-April, not the first six, the 6 weeks from March 1st to mid-April, year over year, statistically has about 3,000 deaths. So that's like the natural rate of death in Guayaquil or Ecuador. But that's the baseline. So 3,000 is sort of people who have heart attacks, they get hit by trains, they just die for no other reason than they just die. 3,000. And in the last 6 weeks from March 1st to April 15th, they've recorded approximately 11,000. So last time I checked, 11,000 minus 3,000 is approximately 8,000. So they report 450 to 500 extra deaths, but they have an excess fatality rate of about 8,000. So even if half that 8,000 is COVID, that's still a fairly astonishing number. So, you know, it's for the people who don't get that sick, it's not a big deal. For the people who get really sick, it's nothing to be trifled with. But that's not really the problem, as far as I can tell from what I'm hearing, is there are people who will tell you that it's not as bad as the flu, or it's a little worse than the flu, or it's about the flu in terms of fatality rates. And we don't really know that, but let's just suppose it is. That's not really the problem. The problem is that we have a hospital system that we business people, in fact, it's our fault, have tried to make extremely efficient because we don't want to bear these large healthcare delivery costs. So in making it less costly, we have to try to make it more efficient, which basically means it has got to be more utilized, which means there are, generally speaking, fewer beds free, particularly intensive care beds, because those are the most expensive beds, and intensivists, we want fewer of those, intensive care. So we get all those numbers down and we get utilization up. And, you know, then this happens, and it's not that the absolute rate of people dying is huge. It's just that the overflow is very difficult to deal with. And if you can't deal with the overflow, then you have to start making trade-offs. Like you get the ventilator, and sorry, we don't have a ventilator. And that's a decision that no one really wants to be forced to make.
Yeah.
No, it's that overflow that's the problem, really.
Okay, so I have one last question on this particular set of this topic, a set of questions. And it really just has to do with how useful these models are to people in business, because that's our audience. Are they worth following? To be honest, your best assessment?
No, I don't actually think I can only speak for me. For me, I don't think it's that useful for me to follow. I mean, I can understand some of it, and I can kind of understand where they're coming from. But, you know, the reality in St. Louis right now is that we have a certain level of illness happening, and we have a certain level of fatalities happening, and we seem to be managing it okay. So we seem okay. I mean, we're economically devastated. And this is not just the restaurants, it's the university as well. I mean, we've all been put under huge pressure. And that's what really matters. I think the models are, you know, the models are for the scientists to really help get a bead on what kind of capacities need to be shifted from where to where else, and what kind of production we need to engage in to make sure certain things happen. But I think for the average person, I think less news is better, honestly. Wash your hands and, you know, read a good book. That's what I would say. That's an opinion. That's
okay. That's fair. So, but that's a perfect segue to our next topic, because what you just said is important as we think about reopening the economy. So just in broad terms, what's that going to take? There's a lot of talk about it. It's in the news. There are varying opinions. What do you think?
That's a hard question. I mean, the simple answer is it's going to require much better testing. The more complicated answer, because it requires much better testing, because you want to be clear on who can kind of go out and roam, and who really needs to stay shut in. And yeah, that's what South Korea is doing. I mean, South Korea is basically, people have basically given up basically privacy and liberty, handed over their data to the government, and if they get tagged as someone who got exposed, they basically voluntarily go into quarantine. And if not, the Koreans are not a kind and generous people. They'll take you to task. We live in a much more heterogeneous society, and that kind of unity is going to be hard to come by. So short of that, I think just complete transparency and information is the first thing. The second thing is the ability to flex healthcare capacities in the right kinds of ways is the other thing, because this is going to resurge. I mean, I don't think it takes a genius to know this, or to speculate this, but as soon as we kind of open things up, you're going to get spikes. It's just going to happen. And if we just keep reacting by shutting things down over and over again, we're going to decimate ourselves.
Yeah,
I think what it's going to take is kind of a good set of transparent tests that everyone can rely on. And I think we need a little bit of social unity to basically say, these are the ground rules, guys, and there's going to be a death count, and we're going to try to minimize that, and this is how the behavior is going to get us there. Don't think we have that. I think we have problems within governments themselves. Forget society. I mean, it's worse in society, but within government, there are factions that don't necessarily see eye to eye.
Yeah, yeah. We had a webinar a couple of weeks ago with one of MSCI's economic consulting firms, Keybridge Research, and they talked about their best guess, because this was 3 weeks ago now, at what the effect that shutting down like we have would have on metals end markets. And their best guess was that second quarter GDP as measured year over year would be down between 25 and 30%. Does that sound about right to you? Are you kind of tracking that?
So I'm not I'm by choice not a fortune teller. I hope not. It doesn't sound outside the realm of possibility, though. It's really interesting if you think about every recession that I've sort of witnessed as a thinking being, starting with 1987 until 2007, 8, 9. We walked into a recession because stuff was kind of messed up. So, the paint started to peel, so we repainted, and you got like cracks in the wall, so we spackled, and then we replaced some and then eventually it all kind of went to hell, right? That was 2001. Right. 1987. That was the last crisis in 2008. And in this one, I don't think we had such bad fundamentals. We had some weak spots. We had some student debt issues. We had a couple of overvalued startup situations, but nothing really that serious. And the problem is usually things finally blow up and then we figure it out and get better. This time, things were kind of okay, and then things blew up through purely exogenous events, which are actually creating cracks and foundations kind of crumbling, because the guy who goes bankrupt can't pay back their debt, which means the money doesn't go to the bank, which means the money goes illiquid, which means people start to panic, which means, and the chain just goes on and on. So there are a lot of ripple effects that we're going to see that we haven't kind of forecasted yet. So yeah, I think 25% is possible. I'm hoping the rebound will be faster than what we saw in 2007, 8, 9.
Yeah.
But there's also the global wreckage. That's the downside. The downside is that it looks like the consequences are extreme. But the not upside, but the salve on that is that we're all sinking together. So on a relative basis, we're all equally worse off, roughly speaking.
Yeah. Okay.
Who loves company?
So just to bring it home to you just for a second, and I have a couple of questions here. How is the Olin Business School preparing to reopen? Because
we're whacked.
It has some implications for MSCI.
Oh my God. I mean, there are a couple of things. There's some underlying dynamics that we finally have to kind of, no good crisis should go unused. I mean, never waste a perfectly good crisis. Is that the line? we've had some things, we have a lot of reliance on Chinese students, and we've been talking about this for years, and now something's going to be done about it because we can't take those students anymore. Education in general, back in my day, I think about 25% of America went to college. Our day, Chris, in fact, you're in this boat. Right
I'm
now,
older than you, so my day.
The number's like 40%. And the reason for that, I speculate, is that at some point people started to think that college causes success. College may just be correlated with success. The people who go to college may be the ones who do relatively better. But to think that we cause better performance in the job market, I think is kind of faulty. And over the last 2 or 3 decades, we've had an overabundance of applications, and we've overgrown ourselves to the point where we have excess capacity. So we're not unlike retail back in 2008. So we're going to be taught a lesson shortly, and it's going to be painful. So yeah, our space is changing right now. I mean, we think this online teaching that we're doing, which is interesting, but that's not really the challenge in all this. The challenge is the structural foundations of who goes to college and why, from which countries, and who's full paying and who's financed. Those are the things that are really going to kind of give us a run for our money.
How do you think this might change the curriculum that MSCI has in our strategic metals management program? Do you foresee any issues there?
Well, the most obvious way is we're pushing everything back.
Yeah.
And I'm saying something you already know, but in trying to make one of these courses online, we got a lot of pushback from the participants.
We got a huge amount of pushback.
Yeah.
Yep.
Which is, at once gratifying, but also in some sense alarming. It's gratifying in the sense that it's nice to know that the face-to-face method was valued as much as it seems to be. On the other hand, it means we can't collect our tuition for a lot longer. I actually would prefer to keep it the way it is and deliver great value than collect the money sooner. But, there is this question of solvency, and people think we all have these huge endowments, but they're only accessible in certain ways. So we have a lot to work out. I think to answer the short answer to the question, though, is I think MSCI's SMMP will be probably one of the least changed programs from where I see right now. I've already done 2 online reorganizations, and they're okay. I mean, they work fine. There's nothing wrong with them. Are they as good or worse? It's hard to say. They're just different experiences. I believe SMMP was designed for a certain kind of face-to-face relationship building. So I don't imagine we're going to go the online route with that.
Yeah, I do think we're going to have to think about some changes to the curriculum, however.
Oh yeah, sure.
That was really what I was aiming at and didn't articulate it very well, but I think the curriculum is very likely to change.
Oh yeah, I think you have to change that curriculum based on, I actually think there are a couple of silver linings to this stuff. I think the first silver lining is, since America seems to be getting whacked the hardest with case count and fatalities, which might just be because we're being more open about it. It may not be the case that we have so many more from a percentage standpoint, but I think we're going to end up, actually I think we're going to come out healthier, literally physically healthier from this. The second thing is all the stuff that we're trying on the side that's new. I read this article where someone from Great Britain said that the NHS has endured about 10 years of change in the course of 1 week. And that's happening to us as well. So a lot of the things that we thought were improbable or even impossible we're gonna start thinking, hey, actually that makes sense. And I think those innovations will flow into curriculum. So, between session online interactions, why not? That could actually add a lot. And I think the content has to change from the standpoint of, I really believe this is going to bring manufacturing kinds of things more back into the United States. And hopefully at decent margins, right?
Yep.
As a matter of things like national security.
As long as you went there, let's jump ahead and talk about that a little bit for the remainder of our time. I think we've done what we've done at this point. And to state the obvious, we are where we are, but what could we have done that might have changed the outcome? What would have been a better or a more ideal response, Sam?
You mean as it pertains to this?
As it pertains to lockdowns, and supply chain,
Well,
and business in general?
okay. I mean, from the short-term perspective, these answers are going to be all over the place. And if it's not answering the question, stop me.
I'll ask again.
Yeah. From a short-term perspective, having watched the relatively, it wasn't actually slow motion. It happened fairly quickly.
Yeah.
The train wrecks of Spain and Italy, we should have basically gotten testing way ramped up in this country right away. And that's kind of what the Koreans did. I mean, they got testing privatized and ramped up right away. And they got mostly reliable tests, getting most of the infected people pushed away into quarantine. We should have done that, and we didn't. Would have, should have, could have. But I think didn't versus couldn't is something that has to be explored, because the longer term, what could we have done differently is we could have kept more manufacturing capacity in the United States. So I don't know this industry that well, but look at masks. So people were complaining, well, why doesn't so-and-so in the executive office just use the Defense Production Act to make more masks, get them to make more masks? So what does that mean, to make more masks? Does that mean like get on your knees and beg China for more masks? Because that's where they're all being made. Or does it mean, oh, go out and build a mask making factory tomorrow? With what kind of capital? I mean, who's going to give you the money? And then where's the raw material going to come from? And who's trained to make these things? From my understanding, the N95 mask is not exactly a no-brainer. It's not rocket science, but there has to be quality controls in place. And it seemed to me that it's difficult to just go some auto manufacturer and say, go make masks, when the capacities have been shifted overseas for so many decades. So I think that's the discussion that we need to have. I mean, do we start bringing that capacity back and enduring the higher labor costs that US-based wages will cause, which means the price of the mask will be higher, which means that people have to have some incentive in place or some rules in place that says, yeah, you got to buy more expensive stuff just for the sake of making sure that we're okay when stuff like this happens. So I think that long term, we should have kept more capacity and production in the States. We've been saying that for years, but now we have perfect demonstration of why. Well, the other long-term thing we got to do is we can't think of healthcare as a business that needs to be made efficient. That is an error, because if you look at the root of hospital, it's the same as hospitality. Hotels don't build for the low season; they build for the high season. Just like in electric utility, utilities don't build for September and October; they build for July and August, when peak load utilization for air conditioning is. And then you put up with the fact that you're not utilized all the time. So because of our healthcare system, for better or for worse, has at the end of it insurers and pharmacy benefits people that have to drive shareholder value. So they need profit. And as a result, you squeeze it out of the providers. I mean, it works when we don't have stuff like COVID. But when we do have stuff like COVID, it doesn't work so well. So you can't swing one way or the other. You have to find intermediate solutions that kind of make that work. So when this stuff happens, we don't say we can't take the extra body count, right? So those three things: one, the short-term response; two, long-term manufacturing capability; and three, really understanding what healthcare needs to be from a functional standpoint, are three things that we could have done a lot better.
So let me ask you this, and I'm going to kind of make it personal. So pardon me for doing this, but you teach at a business school. You teach executive MBAs, you teach custom business. Yes.
About working capital management.
How are you in the academic community teaching business school students going to talk about assessing the risk versus the reward of having very long supply chains, right? And the whole just-in-time framework of running business and keeping your inventory low? Seems to me that the risk of those just skyrocketed recently, right? And you talked about a balance. How does that translate into a business school curriculum? And might that be one of the things we talk about in our program too?
So this is probably where I'm going to take the most flack. Okay, so let me, from a baseline standpoint, the big irony that I see is, and I've told you this already once, so forgive me for repeating myself, but the great output of the 2008-9 recession was risk management.
Mm-hmm.
And in many ways, risk management is exactly what's pushing us into this next recession. And I'm sorry to say this, but the attitude of every life at any cost is a bizarre calculus. Something that we're not talking about. Actually, some of us are talking about it. I was reading that domestic abuse is like skyrocketing. I can tell you in my own home, day drinking is peaked. I mean, our household alcohol consumption is something that it's just off the charts right now. You're going to have people who are depressed because they've lost everything, their business. There's going to be suicides coming out of this. So, is every life worth every nickel and or dollar? And in fact, I think risk calculus has to change fundamentally. It's not that we have to be even more risk aware. I think we have to be more trade-off aware. Humans are really bad at trading off. Well, we can go completely destitute and save every life, or we can let people die and keep some of our money. We're not good at those trade-offs, and it shows.
We actually have a question about that.
Yeah, I think we need to be more measured.
I'm interrupting you for a second.
Sure.
But the question from the audience is really about, look, we average about 250,000 deaths in the U.S. every month.
Yeah, that's
right? And so where is the risk reward about the COVID-19 disease, and how do you weigh that against automobile accidents, heart attack? I actually think COVID-19 just rose to be the second most common reason for death, behind heart disease. But that took some time in a relative sense.
So
what's the best way to think about that?
Well, I suspect, based on that Ecuador story, and there are two problems with this. One is that I don't know how to answer the question, Chris. I really don't know how to answer this question, because no matter what I say, I'm going to get panned for it.
I never thought I'd be able to stump you.
Yeah. So I'll give you a philosophical viewpoint, and I'm going to leave it at that. People have been dying since people have been around. And last I checked, in 125 years, the tragedy is that about 7.5 billion people are going to be dead, and there's not a damn thing we can do about it. Now, does that mean we should be blasé? No. I think it goes back to this whole notion of, the problem is you have people who don't show anything, and you have people who just get totally decimated.
Yeah.
And the people who don't show anything are going to basically keep people, the people who are going to get decimated are going to keep on getting decimated. So the way to control that is to, and I hate saying this, is to give up some of your your personal privacy, and perhaps some of your liberty for a greater societal good. I mean, and testing is the foundation of that. And then we can start making trade-offs like, okay, I'll go into my home for 14 days because, right now I'm a problem. And that's how society copes with keeping in business, but also saying that, look, I can't protect every single life, but I'm doing the best I can. And, right, I'm going to stop talking now. How's that?
That's acceptable, Sam. Thank you.
Because we don't want to be in the position of saying that we have to be we have to thin the herd. Who wants to say that? That's horribly cruel. That's not what civilized people do. On the other hand, you can't sit there and say that you want to save every single life, regardless of what that life is looking like from a potential standpoint. My dad said this, so I can say this because I didn't say this. My dad's 88, and he said, there's always a time to die. But he's a physician, and he's pretty lucid about these kinds of things. I mean, he's watched death his entire life, so he's okay with it. But not everyone's okay with it,
Right.
And you don't want to be in a position of telling someone you need to be okay with dying. I mean, that's not nice either. So,
right.
Yeah, good question.
So let me ask a little bit more in-depth question about the notion of reshoring based on this pandemic. We have a situation where there are some manufacturers of surgical masks, for example, in the US, and face shields and things like that, some protective gear, PPE. How do we, assuming we really want to reduce the risk based on a black swan event like this in the future, how do we prevent the customers of those manufacturers from just going right back to ordering the lower cost items from overseas?
Well, okay, so let's be clear on who the customer is. Customers typically here are provider networks, right? Providers being hospitals, nursing homes, physician offices, those are typically the customers. And the reason those customers, and so this is where I'm going to sound socialistic in some sense, but the reason those customers, there's a risk of these customers going back to the lowest price provider in China and giving no volume to the guys who are doing it in America, making it in America, is because I hear this very often. The person with the most power inside of any provider network is the CFO. They're the choice maker. It's not the CEO, it's not the COO, it's not the chief medical officer, it's the CFO, because it has always been about the money. I think the great question we do have to struggle with is healthcare about the money? Is it a profit center or is it a cost center? And the socialist answer is we treat it as a cost center and we manage it to a budget. That doesn't always work. I mean, it's easy to say these things, but the private system has certain benefits and the public system has certain benefits, and both have liabilities. We're seeing our private system liability right now. But the public systems haven't done that great a job either, if you look at it, which gets to the question of how do you prepare? So, okay, let's go back to this example of hospitality and natural monopolies, utilities and hotels. The great thing about those markets is that it's very easy to predict when holiday season is going to be. Right after 4th of July until about September 1. Okay, tell me when plague season is going to be. When's it going to be? I mean, who knows? So are you going to sit there on fallow capacity for decades waiting for the plague to happen? And I guess what I'm getting down to is, yeah, this is awful. And yes, this is a catastrophe, but I don't know how you prepare for something like this. So does that, I mean, if I were in charge of the planet, I would say, look, every now and then we're going to get the poop kicked out of us by nature, and man versus nature. I tell you who wins every single time, unambiguously. It's nature. So if you know you're going to lose, don't worry about it. Take your lumps and then, lick your wounds and get back to work. So if you're asking me, Chris, how should we prepare for the next pandemic? I guess my genuine answer is, look, make sure you have a functioning healthcare system. Make sure you have a relatively healthy economy, the best you can, despite business cycles, and just get on with life. And don't worry about the next pandemic. It'll happen. But when it happens, try to cope with it based on what the best preparation for the next pandemic is don't forget this pandemic. And people say we forgot about the Spanish flu. How can we forget about the Spanish flu in 1920? Well, I'll start with 1 century. That's
100 years.
It's a long time.
Talk to the Chicago Cubs fans about that.
Yeah. So I think we don't try too hard to manage that kind of risk, but we do some things that are in fact sensible. Because I think what we're finding out is that a lot of companies don't actually have global supply chains. A lot of companies really have Chinese supply chains. That is not a diversified supply chain. And I think that in itself is risk. So if you were diversifying China and then Middle East and Southeast Asia and Australia and Latin America, if you had a diversity of sources, we wouldn't, if we really had a global supply chain for most of our companies, we wouldn't have been as stressed, I think. But because we had primarily Chinese supply chains, we in fact got, we got whipped pretty hard. And I'm sure the audience knows a lot more about
it. Started in Wuhan, right?
Huh?
where a lot of these things are manufactured.
Yeah.
Yeah.
Well, Wuhan is a transportation hub.
Right.
It's a logistical hub. That's what it is.
Right.
Now, why you would put the Wuhan Institute of Virology in, a supply chain hub is kind of a question that I would ask.
So you just asked another question, and I need to ask you this.
Uh-huh.
You brought up a topic that I find somewhat interesting,
Uh-oh.
and I'd like to get your take on it. I read in the paper just last week that the U.S. intelligence agencies are looking into the source of the pandemic in Wuhan, China, and there are suspicions that while it may not have been weapons research, that the source of the COVID-19 virus may indeed be the research laboratory in Wuhan. What's your take on that?
So first thing I'd say is, if this is their best attempt at a weapon, it's a pretty shitty. I'm sorry, it's a pretty bad. Sorry about that.
I don't have a button that prevents that from being broadcast.
As far as this is not a good weapon. If you want to learn about weaponized, bio devices, go read this book called "Devil in the Freezer." It's Richard Preston's first book. It's about smallpox and anthrax as weaponizable, things. This wouldn't really cut the bill. So the first thing I try not
accidental. Accidental.
The first thing I try not to do is engage in idle speculation, because what does it really get you? I mean, if it was released from the lab, then it was, and here we are. Things have gotten released from US labs too in the past, if you just check your history. But I think from the standpoint of, who's guilty of this, even if we found out, which we won't, it won't matter, because we are where we are. And every nation that I know of has engaged in its fair share of carelessness. So if, God forbid, the Chinese actually let this loose by accident, because a lot of labs are studying coronaviruses. I mean, that's an area of research. Then hopefully they'll learn their lesson and make sure it doesn't happen again. If they didn't do that, then we can talk about deforestation and all that stuff that gets people in contact with animals to facilitate species jumps. But I don't know. I mean, that's the cost of progress.
We have a couple of questions that have come in about the economy and a potential recovery. Number one, what do you think the pace might be? In other words, are we talking about getting all the way to this time next year before we see a recovery, kind of what people call a U-shaped recovery, or are we looking more at the V-shape that drops quick and comes back fast? What do you think?
Yeah, I am generally of the belief that when things come down really hard, it always takes a while to get back to where you were. So I don't think it's going to just jump right back up, because going back to what I was trying to communicate earlier, we went in with relatively strong fundamentals, but we're going to walk out with weak fundamentals. So I don't think the rubber band is going to snap right back. I mean, but again, I'm not a trader, so I'm not really sure. I think we're going to see a lot of volatility for a while. It's going to go up and it's going to go down. So just put your money in the market and hang on. Will it take a year or two? What we need, the two things we need are testing and vaccination. And maybe treatment. I mean, if we get treatment, it's even better. But if we get testing to happen, I think recovery should be faster. If we get vaccination to happen, it'll be even better. But vaccination is not easy, because you got to first figure out what works. Then you got to test it to make sure it doesn't kill more people in the meantime. And then you got to get into production. And getting production to happen, I mean, just think about 310 million doses of vaccine. I mean, really? You can't just do that. That takes a long time. So I think when someone says 18 months, that's the earliest, maybe 24. So I think we're in this for the long haul, which is why I think we have to really rethink about this kind of balanced approach to risk management. You can't just do all life at any cost. It's not feasible. And that sounds horrible to say that, because I've got a parent who's 88 years old, and he's at risk. You know, and I've got good friends who are immune compromised, and they're
Yeah.
at risk.
Yes. So we're almost at the limit of our time, but I do want to ask you one more question, and I'd like to understand what you think the changes will be that we will retain going forward, and what might this dealing with this pandemic and learning how to come out of it and stay out of it do to the way businesses are run, the way events are handled. I mean, you are a professor. You know, when are you going to feel comfortable going back and teaching face to face in front of 30 to 50 students?
Oh,
What kind of
well,
changes are we going to see that are
yeah.
going to stick with us?
I'm one of those freaky people who thinks that we're all going to get this, and the sooner we get it, the better. So I'm ready to go face to face now.
You go
My
first.
school, yeah, my school is not. Here's, I think this is where the volatility is going to come in. So we just got some good news in St. Louis, and I've been going for a lot of drives lately, just tooling around town in my car, and I was driving by this place we have called Forest Park.
Mm-hmm.
I didn't see a whole lot of social distancing going on. So we'll get good news, and once we get good news, people are going to relax, and then we're going to have a spike in infections, then people are going to panic, and then we're going to, get back to kind of.
So it looks like this.
Yeah, I think it's yeah, I think we're in for a little bit of a jagged ride. That's what I think. This ain't going away. We keep using the word pandemic. This is no longer a pandemic. So, if you look at the stages, an epidemic is a localized outbreak, right? That was what Ebola was. Ebola was an epidemic. It happened in Africa. It really didn't go epidemic in America because we had controls. When the cases happened here, we just stopped it. Pandemic is when it's happening on multiple continents, and we've already had that. So what we have right now is what my dad would call, and he's a doctor, so this is where I learned this stuff from. We have a situation that is now endemic, which means that the viruses are, and I do mean viruses, because there'll be mutations and variations floating around, which is normal. Sure. All viruses do this. They're going to get nested in society, and they're going to creep back out, and then they're going to go back away, and they're going to creep back out, because we have these pools of people that don't exhibit symptoms. So those are going to be the natural so-called reservoirs. And as soon as we put our guard down, whew, and what we have to really be measured about is our reaction to it. If we just do these rolling shutdowns, again, it's going to be a huge problem. If we have enough testing transparency and hospital capacity to deal with those little spikes, then I think we'll be relatively okay. The sooner we get to that, I think the sooner we'll, it's like the great moment in AIDS research was when finally doctors said, it's not about cure, because we're never going to cure this thing. It's about disease management. Same thing with COVID. I mean, we keep focusing on the vaccine. It may not be about the vaccine. It may be about just managing the disease in society, and being alert to the reality that, yeah, there's going to be a count. So.
Okay, I think we're a little over, but I think it was.
Okay, I'm sorry.
That's okay. I didn't stop you on purpose. I want to thank you, especially Sam. It's always nice to see you, even if it's on video, and talk to you and get your opinions on things. You have a wide and sometimes deep experience base, and it served us well today. So thank you. I want to thank everybody else for attending today's webinar. And this is but one in a series. So we're doing about one of these webinars a week. Please watch for promotions for the other ones. You'll receive a follow-up email in about 24 hours, and that's going to have a link to a post-webinar survey in it. I'd really like you to complete that survey so that we know what kinds of topics are of interest to you as we go through this process, because we'd like to be of use and of value to our members who are willing to listen in. And so on behalf of MSCI and the Olin Business School and Dr. Samuel Chun, thanks for joining us today. Have a great rest of the day, and stay well, and be safe. Thank you.
Bye, everyone. Thanks.